Hospital-acquired pressure injuries result from the cumulative effect of exposure to prolonged pressure and can occur across the acute care continuum. During the course of care, a patient may spend hours on a stretcher in the emergency department, then on the operating room table or interventional radiology table. These settings are places where many hospital-acquired pressure injuries begin and are frequently not observed until the patient reaches the intensive care unit. In surgical procedures lasting longer than 3 hours, tissue perfusion can be compromised. The inevitable prolonged contact of the body with the OR table creates unrelieved pressure points that are the primary cause of pressure injuries. Perioperative guidelines recommend repositioning the patient every 2 hours. That can present a challenge to staff or is unattainable at times. Clinical studies have shown that the number of hospital-acquired pressure injuries developed intraoperatively for procedures lasting more than 3 hours is approximately 25%. Our team of healthcare research professionals have developed an innovative solution for pressure injury prevention. Multiple rows of geometric nodes within the surface operate by inflating and deflating dynamically in alternating sequence every 5 minutes to provide tissue offloading, thereby relieving pressure points on compromised patients. Due to its offloading capability, the DABIR Surface can help maintain tissue viability when patient repositioning is not an option. Patient stability is maintained throughout the procedure with the low-profile design of the surface that is less than 1 inch in height when fully inflated. This alternating pressure technology has been used successfully in thousands of surgical procedures. In a peer-reviewed clinical study, the DABIR Surface was shown to decrease hospital-acquired pressure injuries from 6% to 0% in neurosurgery cases. In another study, hospital-acquired pressure injuries were reduced from 3 in the previous 12 months to 0 in the following 12 months for head and neck injuries using the DABIR Surface. DABIR systems are simple to use and easy to maintain. Surfaces are available in many sizes, transforming any type of bed into a specialty bed with ease. The low-noise control unit connects to the surface through a hose assembly and works with any standard power source. With the DABIR Surface, pressure injuries can be minimized, potentially reducing costs associated with pressure injury treatment, readmissions due to hospital-acquired pressure injuries, and specialty bed rentals. In the U.S., acute care incidence rate for hospital-acquired pressure injuries stands at 1.6 million, which equates to $11 billion in treatment cost. Approximately 25% of pressure injuries are acquired intraoperatively during surgeries lasting 3 hours or more, and the treatment cost for surgical hospital-acquired pressure injuries ranges from $750 million to $1.5 billion annually. Whilst DABIR Surfaces offer a unique and optimal solution in the operating room, the system is well suited for the entire continuum of care. DABIR Surfaces can accommodate patient populations ranging from pediatric to bariatric patients. Surface sizes may be customized to fit special needs, including wheelchairs and other unique applications. DABIR Surfaces represent a revolution in healthcare technology from a company committed to improving patient outcomes.